every kind of psychiatric condition and every clinical situation. I've also interviewed people for the federal government and for academia. And uh, out of these interviews, what's going on is discovered by getting information out of people. And over the years, I found that there are fundamental principles of communication that helps you get to where you want to go. So let's start with pro se litigants. People who are representing themselves are seeking access to justice. And in civil cases, pro se litigants, many of them brave the legal system without many essentials, without an attorney, without legal expertise, without knowledge of the court system. Now, we all know court systems can be very different. If you take the First Circuit, for example, the district court in Maine will be different than the district court in Boston, and that culture will be very different than the court in Springfield. So there's not just legal expertise, but there's trying to figure out how to navigate different cultures without any help. And while there are clinics now that are cropping up to aid pro se litigants, there still are setbacks that can arise from a lack of knowledge. 86% of low-income Americans receive inadequate or no professional help for the civil legal problems they face. Those are statistics from the Legal Services Corporation. So you have people who are do-it-yourself, attempting to navigate the courts. And while some could be famous lawyers who've decided that they're better than their colleagues and can represent themselves, many people are burdened up by hardship. There could be a single mother who has children and just lost her job. There could be someone who's in prison. Uh, there's the whole spectrum of human beings. So, along with lack of resources, some of the people who may be forced to be pro se have impaired communication skills. In addition to the lack of legal knowledge and with the inability to navigate the court system well, they can find they're even further burdened by hardship. So many of you who deal directly face to face with pro se litigants realize that when you have people who are extremely stressed, they can be difficult. Now, let's remember, any of us can be difficult, right? We could be trying to head to a wedding to do the reading, be stuck in traffic, get caught behind a traffic jam, and become difficult people ourselves. And when you have people who think they may have a claim when they actually don't, or when they get bad news or find out that the wrong paperwork was filed after all the effort they put into it, there may be stress reactions and negativity, hostility, even someone bursting into tears and be inconsolable. That can evoke stress reactions in people in the court system. Those of you who serve, who are working directly with pro se litigants. So the courts deal with the whole American population, and that means all human beings. So as George Washington said, we must take human nature as we find it. Perfection falls not to the share of mortals. So we are there to serve no matter who it is that we are there to work with. So in addition to perhaps lack of resources, hardship, mental wellness and mental illness are they're part of what human beings experience. Most of us have one medical or psychiatric condition. Psychiatric conditions are common. So I'm a card-carrying epidemiologist, and I can tell you that about 1 in 5 people in the population have a psychiatric condition at one time or other, and that includes not only psychiatric disorders such as depression, anxiety, post-traumatic stress disorder. That also includes people who may have substance use disorders such as difficulty with alcohol or other drugs. And when we say a psychiatric condition, what we're saying is that this human being at this point in time or over time has symptoms that interfere with their ability to work, their ability to stay in a relationship that's meaningful to them. And this happens to all people, all walks of life, rich or poor, all ethnic, racial groups, both genders. But what I want to emphasize is simply because someone has a mental illness or is diagnosed with a mental illness, that does not mean that they are not competent. That's very important to remember, especially when we're faced with behavior that's difficult to deal with. And it's a human rights issue that mental illness in and of itself, as we all know, is not a basis for depriving people of their rights. So, the court processes, the different court processes, the legal knowledge, whether the pro se litigant is a plaintiff trying to get something that they feel they're entitled to, or whether they're being sued, even homeless people, um, they can face the very daunting demands of self representation, do it yourself lawyering, complicated by also trying to manage mental health conditions. And mental health conditions are the symptoms are on a spectrum of severity. So, what mental health resources do we have to help distressed pro se litigants to help them cooperate, work within the parameters of the court, cooperate with court processes, and also help those of you who are helping them um, cooperate when there's a feeling that there are obstacles. So, we do language that may be the measure of our lives. Toni Morrison, in her Nobel Prize winning speech, summed it up. We die, that may be the meaning of life, but we have a privilege. We do language. And the words we use, words matter. That may be the measure of our lives, and that includes using language as a very powerful weapon to help pro se litigants and help us as we serve them. So, to summarize an acronym, because in medicine we love acronyms, and it's good to have something to remember in a difficult situation. So the strategy is first and foremost aim to develop rapport with the pro se litigant. Observe, observe the pro se litigant, how they're responding to you. Listen. Listen cannot be overemphasized. Um, Listening is what will help you the most in communication, and communication will help you drive rapport. So, again, listen, and I really mean listening. So, we'll go over that. And once you get a sense of who's your audience, who is this human being who's a pro se litigant who's in the courthouse um, getting information from you or trying to get something done with you. It's very important to listen, and that will help you elicit critical information and respect. Respect is essential at all times, even before you start talking. Approach whoever comes in with respect, and all of that will help you move forward on solutions, whether it's um, letting the pro se litigant know they need to put it in writing, um, or whether it's just informing them of the next step. Rapport. Rapport is critical. You are the culmination of all of your experiences, and the pro se litigant comes in to the courthouse, and um, they are expecting something that they feel is very important to them. And the most powerful way to prevent escalation of agitation and the most effective way to de escalate is by aiming to build rapport. And at times, while you're serving people who are getting more and more agitated, more and more hostile, you're thinking, who has time to build rapport? But even in an airplane, um, when there's an emergency, one of the most critical things you can do to de escalate and diffuse the situation is to aim to develop rapport. And that also means observing the other person. I see someone raise their hand. Oh, can you type the question, please? Whoever asked the question, you can either type it, but as I go on, I may be answering your question. So let's see. Okay. So observe. Observe the other person. Um, have a sense of where they're coming from. When I want to really understand what's going on with a person, I don't even want a table between me and them. I want to see the whole person and also observe yourself. Observe your body language, your eye contact, how you're interacting with the person. All that's very important information as you continue to interact with the pro se litigant. So now we're getting to what's essential. What do people want? People want to be listened to. And everybody wants to talk. And there's a sense of, um, I only have so much time. I don't have time to listen to this whole story. But you really need to listen to find out who is it you're talking to. So you turn your entire attention. You put your heart, your soul, your mind, and you focus on this human being. You put your iPhone away. You don't look at your phone because when you look at the phone, that doesn't feel good to the other person. And you listen very carefully to what they're saying. And let me just say, in general, people don't listen. People can meet each other at a conference, they'll tell each other their name, and we can walk away and not remember the other person's name. But a name is somebody's identification, that's their ID. Remember their name of every single pro se litigant you work with, and that will be important for you to remember and use and show that actually you are paying full, undivided attention to this human being. My next slide is listen, because I can't emphasize listening enough. It's going to be going back. It's going to be so important how you respond and hear everything that the person is saying. And as an investment, there are some people who will want to talk more than you think should be allocated in terms of time. Uh, but the more concerns you have, the more you need to listen. Let them tell you their story, and this is where it's going to be an investment in time for you. If they, whoever it is, whoever their background is, however they're feeling, if they feel listened to, then they're actually going to develop rapport with you. They're going to give you information, and you'll be able to elicit the information you need more easily about what's the court's business. And by listening, by having that person feeling that you actually are trying to move them along in the process, they are going to be less likely to escalate into hostility. Should they have a poor response to bad news? Respect. Aretha, Queen of Soul, had it spot on. Respect. That is what every single human being wants. And it's so important to maintain the attitude of respect from beginning to end of any interaction with a pro se litigant or any other human being. So um, there are some people, they can be very busy people, and they will show the ultimate respect to another person who's in that room. Um, Justice Sonia Sotomayor, for example, it doesn't matter whether it's a 5-year-old or an 80 years old person. She will give that person undivided attention and make that person feel special. When you let people know that there's no one else that you're thinking about, you're not going anywhere, you're just going to talk to this person, listen to them, find out what they're asking. Um, this this helps develop rapport, which is one of the most important ways to prevent escalation and diffuse potential confrontation. And then solve. You have information, you're beginning to understand who your audience is, who this pro se litigant is, what it is that they want, and that will help you get more information, finding out what it is you need to tell them. So, there's no one size fits all strategy, of course. Again, what you want to do is with pro se litigants, even in your personal lives, you want to be able to read other people, and you want to be able to appreciate where they're coming from. And there's no one size fits all strategy. You're not going to pop out a checklist and say, check, 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 I've done that, and now things should work. And it's going to take your total focus on individuals. And the more you feel that there could be an issue, that there could be confrontation, that there could be hostility, that's where you really focus your total attention and really observe. You really listen. You're listening fully. You're getting a sense of where this person is coming from. You're eliciting the information that they want to give you with total respect, and then move forward with court business. So it's wearing to have people, when you tell them what they need to know, such as put it in writing, and you see that person just fall apart and weep. It's very wearing on people, and there have been famous psychiatrists who've discussed that those work with the severely mentally ill. It can be draining, and you need to find ways to refresh and rejuvenate. But in the court situation, particularly in these times of um, questioning government, questioning the rule of law, with sovereign citizens that can come into the courts, confrontation is actually the most challenging and of concern for many people when that's the case with a pro se litigant, for example. So, if you see the other person is um, being hostile, just take a moment because the neuroscience is that uh, when we face hostility or situations, and I'm not just talking about the pro se litigants, I'm talking of those of us who serve and are interacting, the fight or flight response can kick in. And as we know, the pupils dilate, the heart starts beating fast, your respiration gets more shallow, and that's actually not good for your health. It's not good for your cardiovascular health. And you can actually trick the brain into thinking um, that things are okay by actually focusing on your breathing. It may feel like a long time, it's a short amount of time. And once you get yourself, for those of you who find you're in it, out of a fight or flight situation and you're calm, you can think more clearly dealing with the situation. So inhale, 2, 3, 4. Exhale. Inhale, 2, 3, 4. Exhale. Inhale, 2, 3, 4. Exhale. That's very important. Everybody knows it, but in a situation where you're trying to prevent escalation, you can forget. And that's where rollers comes in, roll with it, build rapport. So how do we build rapport? One, perspective. Again, realize as you're listening, you are the culmination of your life experiences. And a lot of people, when other people are talking to them, they're not listening. They're thinking, oh, what's my response going to be? But you really need to listen. You need to get their perspective. And what's important is not to shove your perspective on somebody else. And there are pro se litigants who've been subjected to trauma. There are those in the forced passivity of being in prison can also traumatize them. Uh, some people who have been in the enforced passivity of prison then um, can respond by blowing up and becoming very aggressive. But you really want to focus on getting their perspective and being extra respectful and polite with folks who've actually been disenfranchised and suffered the slings and arrows of misfortune. When I'm talking about listening, building rapport, you need to be sincere. The empathy that's expressed, or even just feeling the empathy with the situation, with their predicament, it's not personal to you. So, of course, you maintain your professional demeanor, but you can feel empathic towards their situation while they're talking to you, while you're focused on them. And in terms of not just words, but language, body language is very important. Speak softly, low tone, where appropriate, have good eye contact. As we know, culturally, there are some groups where culturally it's rude to have too much eye contact. I worked with Native Americans, Tlingit and Inuit, and in those cultures, to be respectful, you don't have eye contact. But what you do is you wait, you allow silence, and again, uh, what you're communicating with your body language, with your words, is essentially civility, kindness, empathy, with open body language. One pointer I have is avoid saying, I understand. Um, the person can be talking, 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 and the reflex is to say, I understand, I understand. Don't say, I understand. First of all, you don't understand. And it can be that that person who seems just perfectly usual to you, they could be hearing auditory hallucinations. I had a patient when I was up in Boston who was a lawyer who was very successful, but he was listening to auditory hallucinations all the time. But he had a successful career. There's that expression, don't judge someone till you've walked in their shoes. Well, you're never going to be able to walk in their shoes. You don't know where the other person is coming from, but that's why you build a rapport. You listen and you try to find out what is happening as best as I can tell with this person. So rather than say, I understand, it's more effective and helpful in your work to say something along the lines of, tell me more so I can better understand. And you want to avoid, particularly with people who are under resourced, have there are some who come in, they've suffered multiple traumas, complex traumas. They can be depressed, they can be anxious, and that can lead to other. Once you have one psychiatric disorder, that can drive you to something else, such as trying to self medicate with alcohol. So you want to get a better sense of this person you're working with and avoid statements that begin with you. Because if you say you, particularly if you're feeling rushed, that can sound accusatory to the person. So that's uh, that's one statement to avoid that can be helpful to you. And in terms of body language, avoid finger pointing because that also can be misinterpreted by this person um, who you really don't know where they're coming from. But what you're trying to do is get them to give you what's court business. So again, we said of all issues, confrontation is the most difficult to manage and can be the most distressing to those of you who serve and work face to face with pro se litigants. So the first thing you want to do to de-escalate is aim to create rapport. And one of the references I put at the end is even on an airplane, in the air, if you have someone becoming agitated and becoming a source of concern to the entire airplane, the first thing you do is aim to create rapport, whatever way you can do it. And it's communication, it's using language sincerely with respect that builds momentum towards rapport. So listen. And it's always important to remember um, for those of us who serve, take their frustration seriously, but don't take it personally. So, you're actively listening. And when I mean actively listening, what I mean is, again, put your full attention on this pro se litigant and work on de escalating if they happen to get revved up because they're unhappy about news they've received or outcomes that they're unhappy with. So, intentionally breathe, breathe the 3 times, trick your brain into thinking everything must be fine because she's breathing normally. Be sincere. Uh, use use the acronym strategy, roll with it, rapport, observe them, size them up, and remember they're sizing you up. So um, be very careful of your body language, your eye contact. Make sure you don't point your fingers and listen to them. That will help you get the information you need. Always treat them with respect, treat yourself with respect, and make them feel special. When you make someone feel special, they are far more likely to talk with you and tell you their story than to act out. Then, to really let them know what that you've been listening to them, you can repeat back the key points of what they said. That lets them know you were really listening to them, in addition to your attitude, your posture, your approach. And thank them for bringing the issue to your attention. Uh, that develops rapport. So now I'm going to talk to you about paranoia, which is a particular concern. And I'm not turning any of you into psychiatrists, but it's important to understand paranoid mechanisms. So everybody can be paranoid, and the range of severity is great. Paranoia can be prominent in either personality disorder, schizophrenia, dementia, neurosis. It can be in any condition and under a great deal of stress. Some people can become very paranoid, not just hypervigilant. But what I want to talk about are paranoid people, that there are some patterns that are common to all paranoid people. And they tend to be suspicious, tense, anxious, essentially unsure of themselves. And the greater the degree of paranoia in the person you're dealing with, the more difficult it will be to establish rapport. Paranoid people, and again, there can be people who have personality disorders where paranoia is prominent. They can be tactless. They can feel superior, appear arrogant, grandiose, and they tend to antagonize other people. So they not only antagonize other people, it's difficult to actually build a rapport with them, and that will be more of a challenge. So people who are paranoid have a major preoccupation with justice and rules. They're concerned about safeguarding their rights. They may be involved in martial arts. They may possess firearms, knives, other weapons. And their compulsive concerns for honesty, fairness, and dedication that they'll talk about is found to be a thin disguise for concealed rage. So people, when they're paranoid, they mistrust other people, and they insist upon a literal interpretation and rigid enforcement of rules, regulations, laws. And yet at the same time, they're unable to appreciate the spirit of the rules. So they may interpret the rules without caring about or considering other people's feelings. And they can use the rules to control direct expression of their own aggression. Also, people who are paranoid can filibuster. What they will do is they will start the conversation and they will not allow you to get a word in. They will just continue to talk and talk and talk and talk. And the best approach that you actually have to discourage someone who's paranoid from escalating into a more aggressive stance is to maintain a formal, earnest, sincere, and calm attitude with them. Now, they may be staring at you with a fixed stare, and that fixed stare can make people uncomfortable. But it turns out it's very important for you to actually continue to hold their eye contact, and they actually view that as interest in them, and they like having you interested in them. Never say anything that can be used against you. Uh, Choose every word carefully when speaking with paranoid people, and trust your instincts. Remember, I said listen to someone with your ears, your head, your heart, your soul. If you get an instinct that there's something odd and off and concerning about this person, um, it's a good idea to keep extra space between you and someone who could be able to become agitated. If you do have concerns around someone who appears paranoid, have other people around. Um, and as Herodotus said, or wrote actually, there is no place for force where skill is needed. Try to show interest, develop a rapport, but if necessary, you have security protocols and other procedures, such as in some situations, protective glass. So this is very, very draining to go through, um, dealing with someone who's possibly going to become hostile and aggressive. And I know what that's like. In the emergency room, when the police bring in someone who's been violent and aggressive in handcuffs, I ask the police to take the handcuffs off and leave. And so I'm dealing face to face, de escalating someone who's paranoid. And there are many reasons why someone can be paranoid. But uh, when this situation is over and that person, that pro se litigant who's very paranoid, has left, depressurize with your colleagues after an interaction like that. It's very important. And whether it's soon after in the back or whether it's at the end of the day, it's important to depressurize and debrief each other. So sometimes uh, some of you have said, you know, there's one man and he keeps asking for the same person in the clerk of court over and over and over. Don't allow that to happen. That should be part of the planning. He should be given somebody else to work with next time he comes back into the court. And also give yourself credit. These are tremendously challenging situations that many people feel it's difficult if unable to manage well, but you do get through it and you do help people. So give yourself credit. Now, again, I mentioned there are many conditions associated with paranoia, and one of them can be that the person is intoxicated or even in drug or alcohol withdrawal. Uh, when someone isn't responding to rational words, gentle verbal redirection, there could be other reasons for it. They could be totally disconnected from reality, and that could be due to psychosis or it could be even substance induced psychosis. So, take into consideration that someone coming into your courthouse may be under the influence. And just to give you some clues about what they could be on with opioids, um, check check the pupils of someone who's continuing to not be rational. So if they're on opioids, they'll have small constricted pupils and they'll have shallow breathing. Alcohol is really creates the most danger of all the drugs that somebody could be on, all the substances. So I think many of you are aware of the picture of slurred speech. They can be disinhibited, unsteady, um, but be very careful because people can escalate to violence when they're intoxicated in particular, as well as in withdrawal. And stimulants, uh, as opposed to opioids, the person will have wide dilated pupils. They can be agitated. The paranoia is not resolving. Sometimes, depending on the drug, they could have hallucinations, but not be too terribly paranoid in their delusions. But know that drugs can be one situation where someone will not respond to the strategies that we're talking about. So employ safety protocols as appropriate. And if you do have a Narcan kit around, just remember, because of the epidemic now of opioids, where people are dying by opioid overdose at higher rates than all of the deaths by suicide, homicide, and accidents together, having a Narcan kit can save somebody's life. Now, many of you have said, okay, those are the skills for interactions in the courthouse. But sometimes I get this pro se litigant, and he keeps calling over and over and over again. And let me step back. As we know, people who are pro se litigants come from all walks of life. So there are some people who may be in prison, and their only way of pushing back against authority is by filing claims. There are some people who they're new, and just giving them some straightforward reassurance with the step that within the court parameters you're to give them the information about. Um, and there are some people who have a pattern of, if the court closes at 5 o'clock, they rush into the court every Friday at 4 p.m. So there are all different kinds of people, and there are some who, yes, they deal with hardship, they have difficult lives, and they call, and sometimes all they want to do is vent and have a shoulder to cry on. And that can happen over and over and over again. And as good people, you can feel it's rude to just simply hang up on them. But you do have other work to do. So if the person is going on, they're not getting to a direct point, and they're essentially telling you the story in great depth that they want to tell you, at a certain point, ask, do you have business with the court? And if they say no, let them know that you actually need to help the next person, and you can politely end the call. That's a very important approach to have, because there are some people who feel as if they need to stay on the phone and don't want to be rude. So we're talking about dealing with people who many of them have had undue burdens in life. Anxiety disorders can be caused by life giving them 1,000 cuts, poverty, worried about the job, worried about the marriage, worried about children, having that fall in. But you need to take care of yourself. So as a doctor, I say a good night's rest a day keeps the doctor away. Get enough sleep. It's easy to say in our crazy, jazzed up society. Most people don't get enough sleep. Get exercise, eat well. You need to take care of yourself, rejuvenate, make sure you have time to enjoy what you love. And remember, as Toni Morrison made it clear so eloquently, language is powerful, words matter, and the words you use are a legacy. So you need to be, I realize language is a privilege to use. Um, Also remember Ben Franklin's words, because sometimes you know how to press buttons and it's so tempting. But remember not only to say the right thing in the right place, but more difficult still, to leave unsaid the wrong thing at the tempting moment. So remember, listen, words matter, and you actually can give a human being a gift, someone who is stigmatized, disenfranchised, by making them feel through your words and attitude that justice is being done. That's a gift. So thank you very much. If we have questions and answers, we'll see. If there's a question, please feel free to type it. Yes, we're going to email the slideshow. So everybody will get a copy of the slideshow on Monday. Any other questions? Um, yes, it's an important question, everybody. One that I deal with all the time. How do I recommend helping a pro se litigant who's threatening self harm? And if you're talking with the pro se litigant and they're threatening self harm, what you need to do is activate the 911 emergency system. And if and of course, the more you can convince them that this is important and to cooperate with it. When we get calls in the emergency room and someone calls from home and says that they're going to kill themselves, we try to get the address and we send the ambulance to their home. Um, it's it's very important to take threats of self harm very seriously and let the emergency room psychiatrist sort out whether there's an imminent threat or maybe there are some people who feel desperate, and the way that they communicate their sense of desperation is to say that they're going to harm themselves. But that needs to be sorted out in the emergency room by psychiatrists. And all of you need to take care of yourselves. So again, work is stressful, life is stressful. I can't emphasize enough caring for yourselves. Okay. All right. What is the best way to handle someone who does not understand anything you are telling them? Well, first thing is, and it's not easy, is to try to find out why. Um, Sometimes there are clues, sometimes there's a person with them, and there are all different reasons for it. Um, Someone may not be understanding, of course, because there may be a language problem. It could be that the person is dissociated from reality at that moment. It could be someone who's having a stroke. It could be someone with a neurocognitive disorder such as dementia. It's going to be very important to get other information. We call that collateral or contributory information. And of course, you um, have the additional challenge of respecting their rights. But if they actually want your help, they may be helping you to find out why it is that you're not understanding what they're saying and they're not understanding anything you're saying. Okay, what are some polite ways to convey to a sovereign citizen that the processes they reference aren't actual policies and that we cannot simply do things without following our own policy? And I, sovereign citizens are a very important uh, situation to consider. And again, thinking about um, how someone who might be paranoid, how they're viewing you, and how best to react to them in these kinds of situations, one thing you want to do is avoid in any way telling them, telling them, insisting that they comply with something. Um, uh, there are people, whether they're paranoid or not, whether they're antisocial or not, who resent authority. And what you want to do is not tell them. Um, they may need to go to a lawyer to find out whether something is a claim or a policy. But what you can do is you can tell them what the policy is in your court, and like a broken record, while you try to build rapport, while you listen to them. And I'll tell you, even with a sovereign citizen or someone from another group, that the group may be aggressive and not identify with the government, you still want to try to develop a rapport. At that one moment in time, you want to build whatever rapport you have until that person is out of the courthouse. And um, I wouldn't get caught up in what's not your process. In the clerk's office, you're not there to give legal advice, but you can tell them what the policies are in the culture of the court and keep repeating that. Yes, yeah, respectful way to terminate a discussion. So, and that goes back to a point that I made, that um, allowing a person to talk and tell their story. And again, you need to be patient, and you need to be silent a certain amount. A lot of people aren't comfortable with silence. Um, there's a misconception out there. People think that the person who talks is the person who's in control. It's actually the opposite. It's the person who doesn't talk, the one who listens. Um, the person who talks, they're an open book. You can read them. People love to talk about themselves. Let them talk. It will take time. And at a certain point, yes, it can't go on forever. You will need to set limits for some people, but let them talk, because in the long term, that will save you a lot of time. If they don't feel listened to, they will possibly be angry and coming back feeling that they've been slighted. And that's very important to try to avoid if possible. So, um, after you've heard a certain amount, and maybe it could be 5, 10, 15 minutes, um, you can even respectfully say, this is very interesting, but I actually have another appointment or another person to meet with, and make it a scheduling issue, which they can't take personally. So that's one respectful way. Great. Well, thank you, everybody. It's again, it's been a privilege to talk with you. And on Monday, Maddie will be sending out the slides set to all of you.